Hello and welcome to Pregnancy Info. Today we are going to discuss the excessive or unwanted hair in women. For that we have to understand what is excessive hair. Excessive or unwanted hair that grows on a woman's body and face is the result of a condition called hirsutism. All women have facial and body hair, but the hair is usually very fine and light in color. The main difference between typical hair on a woman's body and face and hair caused by hirsutism is the texture. Excessive or unwanted hair that grows on a woman's face, arm, back, or chest is usually coarse and dark. The growth pattern of hirsutism in women is associated with virilization. Women with the condition have characteristics that are commonly associated with male hormones. Why do women grow excessive or unwanted hair? Women develop excessive body or facial hair due to higher than normal level of androgens, including testosterone. All females produce androgens, but the levels typically remain low. Certain medical conditions can cause a woman to produce too many androgens. This can cause male pattern hair growth and other male characteristics such as a deep voice. Polycystic ovarian syndrome or PCOS is one common cause of hirsutism. It accounts for 3 out of every 4 hirsutism cases according to American family physicians. Benign cysts that form on the ovaries can affect hormone production, leading to irregular menstrual cycle and decreased fertility. The Office of Women's Health states that women with PCOS often have moderate to severe acne and tend to the overweight. Adrenal gland disorders. Other forms of hormonal imbalance that cause excessive hair growth include these adrenal gland disorders. The adrenal glands located just above your kidneys are responsible for hormone production. People with congenital adrenal hyperplasia are born without an enzyme that's necessary for hormone production. All of these conditions can affect the way your body produces androgens. Medications. Excessive body or facial hair growth can also result from taking any of the following medications: minoxidil, anabolic steroids, testosterone, cyclosporine, etc. Diagnosing hirsutism. Your doctor will take a detailed medical history when diagnosing hirsutism. Discuss your medications used with your doctor to help them determine the cause of your condition. Your doctor will likely order blood tests to measure your hormone level. In some cases, your doctor may also order blood work to make sure you don't have diabetes. Ultrasounds and MRI scans of your ovaries and adrenal glands may be necessary to check for the presence of tumors. Assess. Treatment for excessive or unwanted hairs. Hormone management. If you're overweight, your doctor will probably suggest that you lose weight to reduce your hair growth. Obesity can change the way your body produces and processes hormones. Maintaining a healthy weight may correct your level of androgen without the use of medications. Anti-androgen medications. Steroidal androgens and non-steroidal anti-androgens can block androgen receptors and reduce androgen production from the adrenal glands, ovaries, and pituitary glands. Creams. Your doctor may prescribe the cream iflornithine to reduce the growth of facial hair. Your facial hair growth should slow after 1 to 2 months. Side effects of these medications include skin rash and irritations. Hair removal. Hair removal techniques are a known medical way to manage excessive or unwanted hair. There are some hair removal methods that many women use to keep their legs, bikini line, and underarms free of hairs. Number 1. Shaving. Shaving is one of the fastest and easiest way to remove hair and continue your day. Whether you are using a disposable shaver or an electric shaver, both have a built-in blade that lifts and cuts hair at the skin surface. Number 2. Tweezing. Tweezing is another effective and inexpensive way to remove facial hair. This method works slightly differently than shaving. Instead of removing hair with a razor blade, tweezers are designed to pluck or pull hair from the roots. Tweezing works on any facial hairs. It's particularly useful when shaping the eyebrows. Epilation. Epilation is another option for removing facial hair. The technique can eliminate hair for up to 4 weeks, which might be a better choice if you're busy and don't want to regular shave or tweeze. Epilators work similar to tweezing and shaving. This difference is that epilators eliminate facial hair by grabbing multiple hairs at the same time and removing them from the root. Because hair is removed from the root, it takes longer to grow back. Sometimes epilation results in hairs growing back, softer and finer. Waxing. Waxing is another effective way to remove all the hair in an area. There are two different types of waxing kits. Waxing strips that you warm between your hands before applying, wax that's melted in a warmer and then applied to the area with a stick. Laser hair removal. The main problem with many hair removal methods is that results are temporary or only last for a few weeks. For longer results, consider laser hair remover. This method uses a laser and pulsating beams to damage their follicles, resulting in the loss of hair. It's a semi-permanent solution. Hair grows back after about 6 months. Sometimes hair never grows back. If hair returns, it may be finer and unnoticeable. Depilatory creams. Depilatory creams are another option for facial hair removal. The results can last longer than shaving, and these creams may be cheaper than waxing. These creams have chemicals such as sodium, titanium dioxide, and barium sulfide that break down protein in hair so that it easily dissolves and washes away. Although these ingredients are generally safe, there is a risk for reaction. Threading. Threading is another option for shaping eyebrows and removing unwanted facial hair on the upper lip side of the face and chin. The method uses a thread which pulls and twists unwanted hair until it lifts from the hair follicle. The result can last longer than shaving or tweezing. Plus, the method doesn't cause ingrown hairs. Electrolysis. Electrolysis is the removal of hair using an electric current. It treats each hair follicle individually, so the sessions can take longer. Both laser hair removal and electrolysis can be expensive and require multiple sessions to achieve the desired results. Some patients find the treatment uncomfortable or slightly painful. So, if you have the problem, then check the hormonal level, and best way is to manage your hormone level or reduce your weight first. After then you do other options. But you can use the home remedy too. In this remedy, you should take some flour in a bowl and a pinch of turmeric powder and add some milk in it and make a thick paste and apply on your face where the hairs are. And after drying, rub the hairs in the opposite direction of their growth. This will be somewhat painful, but the result is long-lasting, and the next time growing hairs are softer and finer than the previous texture. Hope I have explained all the maximum causes and treatments of the unwanted facial hairs. So if you like the video, then like it, share it, and also subscribe my channel. And you can also give your precious opinion via comment section. Thank you.